this month, October, is recognized on the World Health Organization calendar as a cancer awareness, or breast cancer awareness month, I should say, for all matters affecting breast cancer awareness, early testing, palliative care, patient support, especially in this era of COVID-19. We're now being joined from our Abuja studios by Dr. Zainab Shinkafi-Bagudu, Pediatric consultant and the First Lady of Kebbi State. It's a pleasure to have you on the program. I mean, let's raise awareness on cancer and breast cancer in general. What should a lot of people know now of cancer as a result of, this COVID-19 period we are in that is very difficult to get access to medical care and the likes? Your Excellency.
Good morning. Yes, you have rightly said it. October is the month of awareness for breast cancer. For those of us that do advocacy in the low middle income country like Nigeria, we try to raise awareness on all the cancers, the common cancers for us in Nigeria at the moment. Breast cancer is the most common cancer in the world, cervical cancer, prostate cancer, and then colon cancer. The message and the low-hanging fruits that we emphasize upon is that prevention is better than cure. Early detection is much, much easier than trying to treat cancer. Cancer is a very expensive and complicated disease. So what am I saying? If we live our lives the right way, by eating the right food, by exercising, by doing a vaccination that is available whenever it is, for instance, cervical cancer, you can get an HPV vaccine for young girls or all sexually active people that prevents from having cervical cancer later on in life. It will help. So also having regular screening, going for your tests, like in this month, a lot of organizations, centers are offering discounts, 50% discounts, even free. There are hospitals that will do it for you free. Young girls are encouraged to check their breasts every month to feel for a lump. Even if there is no lump, you know what is normal. So when the abnormal comes, you'll be ready, and then you can go to have it checked by a professional. Men, in November, we're going to be doing for the first time in Nigeria what is known as the Movember movement, and this is going to create a massive amount of awareness around prostate cancer. If we catch it early, for us here in the developing countries, 90% of our cancers are detected late, and so the treatment rate is also a 90% failure. We catch them in stage 3 and 4. Unlike in the industrialized countries of the world, they catch them earlier, and the success rate of curing cancer is much higher. That is my message.
Well, Dr. Bagudu, in the year 2009, you set up a foundation, the Medicaid Cancer Foundation. What was the motivation for that? Would you like to tell our viewers what that foundation has been doing, what it does, and what the plan for the future is?
Well, I like to say I didn't set up the Medicaid Cancer Foundation. It set itself up. I'm a pediatrician, like you rightly mentioned, and I see children. When children come to see me, most of the time in our environments, they come with their mothers. The fathers are at home, they're at work. So the mothers found it easy, where I practice, to talk to me about their issues, which is private. You know, they would close the door, open their veils, and say, "Doctor, look, I have something in my breast. What do I do about it?" So it was obvious that I couldn't cope with it on my own, and we started the foundation to be able to help the mothers to address the problem that they were having. From awareness, we moved on to screening, because I was in a center where we were able to screen. We have a mammogram, the Medicaid Center. We have pap smears. We were doing cervical smear. And then the women will find these lumps when they go and screen, and they come back again and say, "What do I do?" So we started helping them with treatments. We started fundraising on a massive scale, having different awareness events, having walks. We have the biggest walk in Abuja every October. We're going to be having that hopefully this month. We do fundraisers through different means. We also build capacity, training healthcare workers in all over the place. In Kebbi State, we have been able to train across the 21 local government areas. And then as I grow in advocacy, we start high-level advocacy by talking to policymakers to include cancer care in our national health control and our health policies. What do I mean by this? For instance, of late, most people would have heard about the Cancer Health Management Fund. 2 days ago, the Honorable Minister of Health inaugurated the committee that is going to manage or is going to tell the ministry how to manage these funds. Is a 1 billion naira, almost 1 billion naira fund that was set aside in this year's budget for indigent cancer patients in Nigeria. I, alongside a lot of other advocates, were key. For about 3 years, we fought for this money to ensure that it is included in the Nigerian budget because cancer is very expensive to treat. It's supposed to serve as a seed fund where other people, corporate bodies, pharmacies, pharmaceutical organizations, service providers, anybody can contribute to that fund, and then it will grow and will keep on having access to it. So cancer patients can keep having access to the fund so that we can control the disease better. We also do, I mentioned capacity building, screening. I sit on the board of the Union for International Cancer Control. I was elected 2 years ago for the first time, and I was only recently re-elected to continue my tenure on that board. It's a worldwide body that sets policies for controlling cancer in the world, and I was the first African to be elected onto that board. There had been Africans in an observer capacity, but there had been no African that was elected, which shows you why, in a way, we are still behind in cancer management. Such a union did not have African representation.
Thank you, Doctor. That's a huge lapse indeed. I'd like to ask you about common misconceptions that you have heard of or observed that you would like to take this opportunity to dispel about cancer. And also, where are we in Nigeria with regards to comprehensive cancer centers that can really address the needs of Nigerians? Because the statistics in Nigeria are quite alarming. 32 women die of breast cancer daily, 28 of cervical cancer, 16 men die from prostate cancer daily, and 14 men of liver cancer. Where are we on healthcare? You did observe earlier that by the time we get to detection in Nigeria, it's often at stage 3 already.
Yes. So these are the problems that we have for those of us working either as medical professionals or as advocates. The norm and the mindset of our people, they don't believe that cancer is something that they should go to the hospital to look after. The vast majority of Nigerians live in the rural areas, and they don't have access to television or radio, and they don't have the education and the knowledge about the basics of the disease. So when they get anything wrong with their bodies, they tend to go to traditional healers, traditional medical places, traditional health places, and they get the wrong treatment to start with. And by the time they know what to do, or they find that, oh, I should go somewhere, it's too late. You come to the hospital with a fungating infected mass, and really there's very little anyone can do, aside from the fact that it is very expensive to treat. And then you can argue that where are the places to go? You mentioned this, there's a paucity of health care facilities, comprehensive cancer care centers. There are on record 14 cancer care centers in Nigeria at the moment, but really by world standard, only 2 of them can be considered comprehensive cancer care centers, the one in the National Hospital Abuja and the Luth NSIA Center in Lagos. I mean, for a population of over 200 million people, this is not good enough. I know that in the last 7 years, there has been increased awareness and improvements of the facilities. A lot of them are offering more chemotherapy. The drug cost has reduced thanks to increased intervention by the pharmaceutical companies. All of them that offer these drugs are reducing the cost, intervention from the government and advocates. And also, but the chemotherapy centers are one thing, the radiotherapy centers are another. Some state governments are investing in building the centers, but it's expensive. A round of chemotherapy costs 600,000 naira. To treat these cancers, you need up to 6, 10, 12. So how many people can afford that really? That's why, again, you move on to other issues in the continuum of care, like accessing funds and fundraising and providing funding for indigent patients. There are smaller African countries that do it for free. Nigeria is a wealthy country, and if we pull our resources together and we organize it properly, I think we can do much better, and I know we can do better.
I mean, I just wanted to talk to you about a coalition, and the coalition should be, carers. I want to call it traditionalist carers. Sort of like the TBAs. So what maternal health has been able to do over the years is to be able to incorporate TBAs into maternal health treatment. So if a TBA sees a very complicated case, a childbirth, they are quick to send them to hospital because of this incorporation. So when are we going to have sort of like a coalition where, traditional healers can say, okay, I can't do this for cancer, let me send it across to a cancer center, for instance?
Well, there are unions of traditional healers, but the problem is not all of them, not all the so-called healers belong to the proper unions. Those that are organized into a union, they actually do well. And those ones know when they know the limits of the scope of their so-called healing. I really don't believe that any patient should be their first port of call. When there's something wrong with you, that is why we have primary health care centers. They should not be allowed to exist on their own. They can be integrated into the primary health care centers, but not that they exist on their own where people go and access it. There is no state's corner that you go that there is no primary health care centers. What we need to do is to strengthen that system. We have a national primary health care system. Why don't we strengthen our primary health care system so that the healers can also play a role in there? How did they win the confidence of the people so much? Why do people go to them? It's a simple case of affordability and accessibility. They are there living with them in the community. They can afford them. Sometimes they don't even pay them money. They give them one chicken, one goat, depending on how serious your illness is. Why don't we do our own primary health care centers like that? We're always talking about fancy things and solutions that don't necessarily fit our own system. When we come to issues like universal health care, it's a very complicated system, and we will talk about the top, the middle, the bottom, but we don't look at our own system. There's hardly any one of us here that doesn't give. You have people living around you that you are taking care of their health one way or the other, whether it is your staff, whether it is your parents, whether it is your sister. We have a form of altruistic giving in our society. The traditional African society and Nigerian society exists by that. But it's not captured into this so-called universal health system that we're all rushing to adopt. So how do we account for that and translate it into our health system? So the traditional health rulers are benefiting from that. People go to them because they're accessible to them. So it's quite complicated, but also quite easy. It's just a case of dropping things that don't belong to us and adapting it in our own way. The people that I work with, and I have enjoyed really working with the most, and I enjoy working with them because I get results. I see outcomes from them, are traditional rulers. All the traditional rulers in my state are my friends. I'm not talking about the big ones only, like the Emir of Argungu or the Emir of Zuru. Those are the main ones in the state, and the Emir of Gwandu, who is number 2. Where I'm talking about the local Meangwa, as they are called, the rulers in the small villages. When we go to a village on advocacy, we don't go and meet the women. Our first port of call is the head's house. We go there and we greet him and we tell him what we have come for. And we're okay. Our problem is solved. Anything he tells those women, they will do. They will do it for us, not because I'm a governor's wife, but because their leader has told them to do it. But we don't utilize them as much as we should.
Well, thank you very much, Dr. Zainab Shinkafi-Bagudu, First Lady of Kebbi State, for your take on the Cancer Awareness Month. Thank you very much indeed.